I'm Dr. Harvy Liwanag. Thank you for joining us for our Decolonisation Conversations series. In the first episode, my colleague Dr. Rhule and I had a conversation about the importance of acknowledging our positionalities and critically examining our life experiences through reflexive dialogues in order to become more self-aware of how we engage in global health and therefore become more deliberate in engaging in it in a decolonial way. In this second episode, we have brought together some of our UNU-IIGH colleagues who, like myself, are nationals of a low and middle income country, but share the experience of pursuing further studies abroad. We invite you to listen to our free-flowing conversations as we reflect on our experiences and explore how we can pursue decolonization in global health, learning, and education. Reflecting on our experience as LMIC citizens who studied abroad, in what ways then can the training of global health students be reformed? Many of these training programs involve international exchanges where people from the South go to the North to study. Of course, we see more of that rather than people from the global North coming to the South to study. But is there a way for us to change that, to make it quote unquote less colonial, if you want to use that phrase?
Being the only sort of Malaysian or Asian international student in the cohort made you adapt. And I feel like that is the rhetoric for a lot of international students. Assimilate, the word is for in Australia, it was, assimilate, join the barbecues, talk with local students. I used to be very active in the International Students Association, and a lot of the narrative that we were fed was do activities that help international students mingle with local students. It's not just about international students finding other international students. It's everyone sort of learning from each other. But I feel like that was a slightly one-sided sort of rhetoric, right? International students have to assimilate with the local culture and learn their ways, which makes sense on some. There's nothing wrong, but it perhaps could have been a little bit more productive if it was two ways.
I think one of the things that I felt in particular, even to a certain extent now as well, it's very hard for me to see people who look like me at the center stage. And there's that lack of relatability. And I think institutionally, a lot of institutions should look at being more diverse when organizing their talks or their events. Even in terms of employment, getting more diverse, especially if you're teaching subjects in the social sciences like development studies, to have more people from the global South teaching subjects, because it just seems a bit weird that you're talking about white men's burden, but then it's also white men teaching you still. So it was very, I think for me, it was very isolating that I did not see someone who looked like me at these events. To a certain extent, I even raised this up with one of my lecturers, and then he told me, then you be that person, change that. I was like, well, that's a lot to ask someone to do, but I think it's the lack of role model could also be one of the reasons why people don't pursue certain careers. You hear this conversation in the STEM education discussions, where there's not enough girls in science, technology, mathematics, therefore limiting a lot of them from pursuing these careers.
What is your experience in terms of grad studies? I imagine you did your master's in Africa.
Yeah, I did in Zimbabwe, yeah.
Zimbabwe. In terms of the course levels, or even for your undergraduate studies, for the discipline that you took, what materials did you read? Would you say, did you find, were there materials that were written by African authors?
No, we never read materials written by African authors, to be honest. Our materials were written by the Western authors. And also even in Turkey, you find that even an expert in Turkish affairs, you would read a book from a Western author. So that's what usually happens in this education system.
The syllabus of global health, of the syllabus of courses are very much so. If you're talking about African issues or say issues in Latin America, then one would expect that the syllabus is comprised of literature and evidence that emerges from some of those areas or perspectives from those countries or from those regions. And you don't see that a lot. Where I see a major challenge is often with colleagues, colleague students or colleagues who have spent maybe 3 months or 6 months or a year in an African country or an African village, and they assume that they understand or they have a total grasp, of the complex social milieu, in the area. And so sometimes their findings or the evidence that they are generating from their thesis or from their research is not properly situated or contextualized.
As George has previously mentioned, that a problem might arise when we have people in the global north who just visit or collaborate with someone in the global south, and boom, the next day they think they are not experts in the global south. So I think in terms of training, when we have people who want to focus on researching the global south, we should really look at people who have got lived experiences of working or living in the global south, who might be able to design courses or to write research or thesis from the global south, so that they can be able to situate their teaching or even their research within a particular context. Because what usually happens is the global south, or for example Africa, is a very big continent with a lot of countries with different communities and different cultures. So sometimes when we tend to teach, especially in the global north, we tend to lump Africa into one aspect or one community. But in actual fact, we have got a lot of different cultures. I also think that decolonizing the global health field cannot be done in isolation with decolonizing the whole education system. So I think it should also start by how we structure our education system, that if people understand how we can decolonize in the way education is being provided to individuals, then it follows that also global health as a discipline will also be decolonized. How can we empower students to balance between the link to complete their studies and also the link to try to change the way the system is being done? So those who are in the position of power or the supervisors, the lecturers, they should also be willing to get into meaningful and fruitful discussion about how we can decolonize global health without penalizing the student. Because sometimes I find that as a student, if you want to stand up against something, we really don't have the power, because at the end of the day, you go to the global north to study.
We're having this discussion, and like I look at my own self. I identify myself as Malay, and I was within the Malay context. I come from a Malay urban context of upper middle class, and I was privileged to study abroad because my parents were able to pay for my education. But my experiences differed greatly from other Malaysian students who were there on scholarships, government scholarships or corporate Malaysian scholarships. So all of our narratives are different. Yeah, so I think it's also interesting to look within like the intra rather than inter. So looking within also.
Yeah.
But
being an international student has made me question my sort of identity and position a lot more than if I had just stayed home. There's so much layeredness to our sort of even identity, like our social, ethnic, religious, gender identity, everything all rolled into one. And I think moving out into the world, whether it's in capacity of an international student or for work, for various, even for travel, I think it does really make you question, your sort of the things that you grew up with, that you take as culture and that are acceptable, and then the things that other people grew up with and take as the norm and acceptable.
Like the conversation about return migrant is really important. And then, because for me, as I came back, I then ended up, I only worked for 1 year with a Malaysian organization. The rest were international organizations, because I felt that I couldn't adapt. I mean, I spent 6 years in,
I hear you.
Yeah. So it was really like a lot of the things, and because I worked there as well, like the working styles and the working culture was very different. And I guess the level of there's a lot of bureaucracy, and like you said, like I think there's a lot of because Asian society, which is a good thing, it's not a bad thing. There's a lot of emphasis on being respectful and things like that. But then in a way that kind of slows things down when you're doing work. All of this bureaucracy, red tape and salutations and everything. And it's just, I think that there was a lot of, it's difficult for you to also then relearn to adapt to the Asian way of working or the Asian culture.
As they say, the migrant never comes home, because, when you leave, that the person that has left ceases to be. And then when you reach somewhere else, you become that new person. And even if you come back, you don't come back the same person, that no same version of yourself ever exists after you leave home that one time.
When you are talking about this decolonization and about global south, my question is, who is really a researcher from the global south? Is it someone born from the global south living in the global north, or is an individual born in the global north living in the global south? Because sometimes I feel if you start with this debate, we've got a risk of crowding out actual people from the global south by people who are not really from the global south.
We are located in a lower middle income country context, or the Malaysian context, and there is a real opportunity for us to show leadership within the decolonizing global health space in terms of bringing in, southern perspective, to have conversations. So the very fact that we have that a program on decolonizing global health, and that we are trying to foster conversations and convene different academics and stakeholders from the global south, in itself, I would say it's a positive achievement.
How UNU-IIGH has been trying to decolonize global health is, from a program perspective, it's with the partners that we engage. So we are actively looking out for more partners within the global south. And I mean, I've been directly involved with like trying to produce MOUs with partner universities within the global south. So that's one way. It's like engaging more with the global south in terms of partnerships. And also in terms of events and workshops that we host, there's a stronger emphasis in bringing in voices from the global south rather than the global north. We actively look for that. So I think programmatically, there is that sense of bringing more voices of the marginalized into the discussion.
I think it's an interesting space for us to critically engage with conversation, with topics that push the boundaries a little bit. I mean, isn't that why we're here? We're not sort of defiantly or kind of destructively push boundaries, but in a meaningful way to construct in a positive direction, right? But you do have to do some dismantling, and there's an element of destruction and uncomfortableness in that.
In this second episode, we've started to explore the importance of decolonising education as a key component of decolonising global health. We've heard how these educational experiences are formative, not just during years of study, but on into our professional lives, and how the changes that are required are all-encompassing, from what is taught, to whom, by who. As we bring this episode to a close, we leave you with these two questions. Reflecting on your past, in what ways have colonial legacies influenced your educational experience? And then reflecting on your professional career, how has this impacted the way that you view and value education and scholarship from and in the Global South?